morning, you're all very welcome. This session is going to cover the National Clinical Effectiveness Committee and specifically focus on the development of national clinical guidelines. I'd welcome your input throughout the morning. We're going to give a horizon scan or view in terms of all of the main pieces that are required in terms of national clinical guidelines to come forward to the National Clinical Effectiveness Committee, and you'll get some more detail as the day progresses. So firstly, I'd like to just talk about clinical effectiveness itself and why we in the Department of Health here view this as a very important agenda in terms of getting evidence into practice. So it's clearly seen as a health policy agenda. It is identified as one of the ministerial priorities for 2015, that is to extend and implement the National Clinical Effectiveness Guidelines. We have tried to engage in a number of ways with social media, so we do have a Twitter account and we try to put out as much information as possible on that. And we do have a new updated, upgraded website which we're trying to build as we go forward, and we'd welcome your feedback on that. So for us, what do we mean or think about when we're talking about clinical effectiveness? We're talking about the extent to which specific clinical interventions do what they're actually intended to do. So the right care, in the right place, at the right time, with the right information, within the available resources. So very much, as we all understand, doing the right thing in the system. So the question is, what can we do to do the right thing? And we feel within the Department of Health that that is around good quality, well-developed national clinical guidelines, good quality, well-developed clinical practice guidance, and also good quality national clinical audit in the system. And internationally, these are recognised as good processes for getting clinical effectiveness up and running as a key agenda. So in terms of operationalising this policy piece for clinical effectiveness, the Minister has established the framework for clinical effectiveness. And this framework for clinical effectiveness involves the establishment of a ministerial committee which represents key stakeholders in order to drive and oversee the agenda. The terms of reference of the Clinical Effectiveness Committee I'll refer to in a few minutes. They have been recently updated in May 2015 and they're up on our website. But basically and briefly as a summary, our role is to establish a suite of national clinical guidelines that have been prioritised, developed to a high standard and quality assured by the National Clinical Effectiveness Committee. We don't intend that this would be a large suite. We don't see ourselves as a large guideline clearinghouse. We see this as a suite of really important items or interventions for the Irish healthcare system so that we can put in place something that's going to work well, we can ensure that it's fully implemented and that we can track that through our various performance assurance processes like the HSE service plan and so on. We see ourselves establishing a suite of, again, key identified national clinical audits that should be operationalised across the system, that we will prioritise and quality assure. This is a term of reference we haven't actually operationalised to date, but it is well developed at this stage in terms that we have developed the draft prioritisation and quality assurance criteria. They are going to our Clinical Effectiveness Committee next week and they will go up for public consultation, so I would hope you would all participate in that over the summer months. And then lastly, that we would develop standards for clinical practice guidance. Similar to the audit, this is a new function that we haven't established yet. They are developed in draft process and we're working closely with Breach here and the HSE Policies, Protocols and Guidelines group in order to get this right. The development of these standards emerged from a recommendation of the report of the Chief Medical Officer into Portlaoise, so that we create a process that we would try and standardise all of the various pieces of clinical practice guidance in the system, like your policies, like your protocols, like your care pathways and so on. That documentation is again well developed. It's going to our Clinical Effectiveness Committee next week and it will go up for public consultation in the summer. And we intend it to be a helpful document in terms of the system and to work closely with how the HSE will be able to operationalise that. So we see these as a good suite or package of interventions to support good quality clinical practice in the system. But what we also see is that we can't do this on our own as a policy piece within the Department of Health. We need to work closely with yourselves within the clinical areas. We need your inputs, and obviously you're the clinical leads and the clinical experts. What we can do is support the leverage and the quality assurance piece around the good work that you do. So in terms of the Clinical Effectiveness Committee, these are our new redrafted terms of reference, and they're around providing strategic leadership for patient safety and quality. They're around establishing a policy agenda for quality and patient safety management. They're around publishing the standards for clinical practice guidance as we have just emerged. They're around publishing the guidance for national clinical guidelines and national clinical audit, prioritising and quality assuring national clinical guidelines and national clinical audit, also commissioning national clinical guidelines and national clinical audit. And we also see, and I'll talk a little bit about this further on, how we can align our work with the various implementation levers in the system. So how we can utilise every process that we have to make sure that if we're really happy these are the right things to do, we can get them implemented within the system. We will report periodically on the implementation and the performance, the implementation of guidelines and the performance of audit. We will establish subcommittees to support our work, and I'd be hoping people like yourselves will be involved in those subcommittees, and we will publish an annual report.